It is such an important issue. For more on all schools reopening and all the COVID latest, joining us now is epidemiologist and ABC News contributor Dr. John Brownstein. Thanks for joining us, Dr. Brownstein. So the CDC says getting all teachers vaccinated should not be a prerequisite to reopening schools. So what's your take on that?
Yeah, thanks, Terry. This is a really complicated question. Of course, we want all our teachers immunized. The CDC put out guidance. They expanded on their old recommendations, and it was really data-driven. It's all about layering safety precautions, right? They focused on masking, physical distancing, podding, hand washing, ventilation, and then, of course, testing and contact tracing. So, keeping COVID under control in a school isn't about one thing, it's about many things. And what we've seen is that schools generally don't contribute a lot to community transmission if you have the right controls in place. And we need to prioritize schools to be open. The issue is that it's context dependent, and many communities across this country have just so much transmission that schools can open safely. And then rightfully so, the focus goes back onto vaccination. And so we absolutely need to be prioritizing our teachers. That's the way that we get our schools back open. And in fact, what we're seeing is many states across the country are now prioritizing teachers. And we're seeing in the coming weeks, teachers will get those immunizations. And finally, we'll start to see schools open across this country.
And Dr. Brownstein, as we mentioned, Texas Governor Abbott is ending the state's mask mandate and allowing for full reopening. Now, there were concerns over the impact that big winter storm would have on COVID rates because so many people were forced to gather together to take shelter. So have we had time yet to see the potential impact of that?
Yeah, I think, we've seen this movie play out over and over again. Cases are actually rising in Texas. We don't know if it's related to the storm just yet. So the timing of ending a mask mandate is just not data driven. We know the storms brought people together in close proximity, probably not wearing masks, and likely that would drive cases up. We're seeing plateauing and increases in cases in many parts of this country. And it's not just because of testing. We're seeing actually percent positivity going up. So we don't know yet if that's a sign of maybe new variants taking hold. But regardless, it's a moment where we just can't let our guard down. And so this end of a mask mandate and other interventions just doesn't line up with the data. And it's forcing local governments and individuals to make decisions for themselves. The good news here is that even when you end mask mandates, we've seen actually people continue to wear masks because they recognize the value of these interventions. And so, what we're seeing is, the population is still behind infection control, even if the mandates aren't happening from the government itself.
And Doctor, the CDC says that sometime soon, relatively soon, they'll have guidance on what fully vaccinated people can safely do. That's becoming a more and more important question as more and more people get vaccinated. Have you got any sense of what that guidance might look like?
Yeah, we're all waiting for that guidance, right? Because I think what we keep hearing about is vaccine alarmism, right? This idea that because vaccines aren't 100% effective, you just can't do anything. You can't start to go back to normal life. And that really isn't true. I mean, we know these are incredible vaccines. They should start to allow us to do things that we once did before this pandemic. We know the CDC is probably going to recommend the fact that you can congregate indoors with those that have been vaccinated, whether it's friends and family. So finally, we'll be able to connect again with others outside our bubble. I think there's other recommendations that we might see. This idea of quarantining after travel. You may not have to do that if you are vaccinated. It may relax testing requirements. So a number of things that we know are huge hassles for living our day-to-day lives may start to go away. I do think that sort of indoor gatherings in restaurants and movie theaters and other places, you'll still see mask mandates just because of the fact that it's just so hard to enforce sort of who's been vaccinated, who isn't. But many things will start to get better over the coming months.
Yeah, we certainly hope so. And you and I have talked in the past about vaccine supplies and vaccines in arms aren't always the same thing. So as production starts ramping up, do states and localities have the infrastructure ready to offer these vaccines to the general public once there is enough available?
Yeah, I mean, we've spoken about this issue and the hiccups around the vaccine rollout. I'll say that there's a lot of optimism right now. We're now averaging 2 million shots a day in arms, which is incredible. I actually think we can get to 3 million a day. We've already delivered 100 million doses to various locations across the country. There's still improvements to make, right? We still haven't quite figured out the logistics at this scale for this many people. We know that there were hiccups in terms of a rollout of vaccines in long-term care facilities. but I think it's also going to be about sort of innovative delivery places. So new inoculation centers like mass vaccination sites or federally supported community health centers. The FEMA is involved. So it's not just about states. The federal government is ramping up. I do think that, community vaccination centers and mobile clinics are going to be super important. I mean, we've spoken about this idea of vaccine deserts, right? Issues where people just don't have access to a supply or there's too much demand. And so, of course, technology is going to fix some of this. But, I'm hoping that in the coming weeks, we're going to be able to really deploy this vaccine to huge numbers of people.
And Dr. Brownstein, I might botch this, but vaccinefinder.org, is that the website?
Yes, vaccinefinder.org is our site that we built with CDC to really help people get access to the vaccine. And, you covered Vaccine Hunters yesterday. There's incredible work that's happening across this country to help get those vaccines out the door and to people.
All right. Great. Dr. Brownstein, great to have you and great to see you working to help people find those vaccines. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.